Hello, my name is Nelson Vergel. I'm here in behalf of IFARA at the Lipodystrophy and Adverse Events Conference in Sydney, 2007, the ninth conference of its type. And I'm here to interview Dr. Yarasheski from Washington University in Missouri. Welcome. Dr. Yarasheski is an expert in exercise research. We are all very interested in this topic since a lot of the patient community in the United States especially are concentrated on exercise as a therapy to improve body composition and hopefully minimize increases in belly fat. So welcome, Dr. Yarasheski.
Thank you.
I'm very interested on the presentation you just finished on the use of Pioglitazone, or what we call, trade name is Actos.
Actos,
with and without exercise. Correct. Could you expand on the results of the study and what surprised you? What was expected or unexpected from the results?
Right, so it's important to note that it's a preliminary study. This is just the first 15 or so patients in the study. The study is going to go on for another 2 years. Basically, we were hoping to show that exercise, when added to this medication that seems to already benefit sugar metabolism and body composition, would actually make the body composition and sugar metabolism changes even better. And what we were able to show preliminarily, again, is that yes, exercise plus the medication improved sugar metabolism much better than the medication alone. The downside was the exercise also helped the people burn more fat underneath the skin. So this was fat underneath the skin at the belly, fat underneath the skin in the arms and in the legs, and that's not generally considered to be a great adaptation. The good side of the story is the exercise, in addition to the medication, also helped them burn what we call the deep fat, the fat in their bellies, the fat that's most associated with things like hypertension and bad sugar control and cardiovascular disease. So the good news is we had a substantial impact. Exercise had a substantial impact on some of the bad fat on the body, but it also had an impact on some of the aesthetic fat, the fat that's underneath the skin in the arms and the legs, that our participants don't particularly want to lose. They would rather just lose the visceral fat. So we're not able to yet partition, can we just reduce at the belly and not anywhere else with exercise or this medication.
But we really haven't found any therapy that reduces visceral, belly fat, inside fat, without reducing subcutaneous or fat under skin, right?
Correct.
I mean,
there has not yet been a medication or a therapy that can do that. There are some thoughts out there, or some hypotheses out there. Testosterone is one of the potentials. There's a study presented yesterday, tesmorelin. This is a growth hormone secretagogue, which they believe may be the visceral fat selective reducer, the belly fat selective reducer. The preliminary data in that study also suggested that, yes, some of the sub-Q fat was not lost, but the visceral fat was lost with that medication.
Very little, though, like 15%. I wasn't really
very
jumping
little,
up and down.
15 or 20%, but it's a step in the right direction.
Yeah, it is.
And you're right. I mean, having nothing and going now to something that we have a little bit of an effect on just the deep belly fat is probably a good step.
Without horrible side effects.
All right, so far no horrible side effects.
Tell us a little bit more about this drug Actos. What is Actos approved for? Were people, people actually need the drug at the baseline? Did they have high blood sugar? Or was it normal people like without blood sugar problems?
Yeah, so Actos is approved, at least in the United States, for the treatment of insulin resistance and diabetes in type 2 diabetics. It doesn't have a specific indication for HIV, and that was one of the reasons why we wanted to do the study. We wanted to make sure that there weren't other safety concerns associated with this medication when given to HIV-infected individuals. But the participants that we studied had HIV. They had impaired sugar tolerance, or what we call pre-diabetes. In other words, their bodies were trying to handle sugar, but they weren't handling it very well. So they had high sugar levels, they had high insulin levels, and they also had this fat redistribution syndrome. Some of them had lots of the belly fat and very little fat on their arms and their legs. And the question was, does this medication do anything to impact the body fat distribution, and does it most of all affect the insulin resistance and the glucose intolerance that a lot of these participants had?
And you did see some increases in subcutaneous, under the skin kind of fat, right?
Right. So pioglitazone has been reported in HIV-infected individuals to increase the sub-Q fat, but only a small amount. In an earlier study presented last year, it was about 300 grams of fat. In our study, it was about 300 grams of fat. So it's a very small, almost not noticeable, at least not noticeable to me, but the participants reported that they noticed, yes, their legs and their arms felt a little fuller or looked a little fuller after the pioglitazone, but it was a very small effect.
And most patients were not taking D4T, right?
Correct. Only 2 patients in the study were taking D4T. One was in the exercise with pioglitazone group, and one was in the pioglitazone. So we were balanced, yeah, previous studies have shown that the benefits of pioglitazone are lost when the patients are taking D4T.
And what side effects do you actually see?
No serious side effects, at least nothing that we were expecting. We didn't see any changes in their hematocrits and their hemoglobins. Their red cells stayed the same. We didn't see any adverse effects on their kidneys. This was only a 4-month study, though, so we need to do much longer studies than this. We didn't see any bad effects on their liver enzymes. Some of the drugs in this class have that bad rap against them that they're going to affect liver enzymes. We didn't see any of that. We didn't see any reduction in T cells. We didn't see any increase in viral load. We probably saw some fluid retention. This is a side effect, a known side effect of this medication. And we had 1 participant out of the 16 that we studied that had a severe high blood fat level only after 2 weeks of treatment with the medication. So we had to be very cautious about who we gave it to, and we had to be very cautious about how we monitored them. We essentially had them come in every 2 weeks to check to make sure that none of these adverse effects were happening.
And can you tell us a little bit more about the exercise program that you actually used for the study?
Right, so it's a supervised, it's monitored, it's prescribed by exercise scientists. These are people who know how to prescribe exercise for all kinds of people who are either very unfit or very, very fit. These participants were particularly not fit, and as a result, we had to start most of their exercise training at very low intensity, somewhere around 50 to 60% of their maximum capacity to lift weights, 50 to 60% of their maximum heart rate on a treadmill or on an elliptical trainer. And then gradually and progressively over the 4-month period, increase the amount of time or the intensity of the exercise so that we could get this expected cardiovascular benefit of resistance plus aerobic exercise training in this patient population.
Good. There's also another poster that you were part of, right? The one on the effects of yoga.
Correct.
And not only body composition, but also lipids and other parameters. Can you expand on that?
Sure. This was a study designed to answer a complementary or alternative medicine question. The question is, are there other ways to treat the metabolic issues that are associated with HIV and the medications? So we combined with a group of alternative medicine providers in St. Louis. They were expert at administering yoga programs. These are programs that involve a lot of stretching, a lot of postures, a lot of breathing, a lot of relaxation techniques. But it was geared towards trying to reduce serum fats, serum cholesterol, blood sugars, blood pressure, body composition, and improve sugar tolerance in a group of individuals who had HIV and had at least one of those problems. Either they had high sugars, or they had big bellies, or they had bad lipids, or they had high blood pressure. The study was another 4-month study, so again, it's very preliminary and very short. We looked at I think we're now up to 25 people who have been enrolled, and they've been randomized to either receive the yoga intervention, which again is about 2 days a week, takes about an hour, hour and a half a day, or what we call a standard of care regimen, which means they're healthy and stable when they come into the study, and the clinicians just simply monitor them to make sure that there are no dramatic changes in their viral loads, no dramatic changes in their CD4 counts, no dramatic changes in their health. And then they're studied 4 months later. So at the end of the yoga intervention, we didn't really expect to see much because it wasn't very intense. There's a lot of anecdotal evidence out there. It's not, the anecdotal evidence doesn't usually have a control group. We thought we needed a control group in the study. And the anecdotal evidence was sort of suggestive that yoga might be helpful. But I went into it expecting absolutely nothing, and I was totally surprised by the fact that, yes, at the end of yoga, the people who received yoga had better changes in better reductions in their blood fat, better reductions in their blood pressure than the individuals who got what was called standard of care, no treatment over the 4-month period. So I was very much surprised, and this was it, and these changes, the lipid changes and the blood pressure changes, impact their cardiovascular risk. There's a little equation that you can use that'll help you predict, what are the chances that this individual might have heart disease in 10 years, and that was reduced by about 2% in the individuals who received yoga. So I was very surprised by the findings and very surprised by the impact that yoga had on these participants.
Well, wonderful. We're definitely looking forward to more studies or research. Do you have anything that you're working on that you may want to tell the community for better accrual? Maybe you need some participants in your area?
Yeah, we're always looking for individuals who are willing, ready, and able to, to come and be studied in an invasive way and be monitored in an invasive way for yoga studies, exercise studies. We're doing a lot of studies on cardiovascular disease now. Our big concern is that, okay, if these metabolic and these body composition changes are going to be with us for many, many years, well, that's probably going to have a bad effect on cardiovascular risk factors. We want to look at what's the mechanism by which these things impact cardiovascular function and heart function, and we want to find out, do our treatments work to improve cardiovascular disease? So the same type of questions: does exercise, does pioglitazone, does yoga, do any of the medications that we have for lowering lipids, for adjusting sugars, do they have any impact on keeping the heart healthy in this patient population? Because they are living much longer. The issue is, now we've got to worry about the diseases that occur with long-lived people. Cardiovascular disease, cancer,
diabetes.
These are all the things that are on the radar, and we're focusing our efforts on essentially cardiovascular disease.
And where do people go to enroll into these studies? What's the contact? Is there a website or address or?
Yeah, we have an AIDS clinical trials unit in St. Louis. The phone number is 314. I don't know the phone number. It's been a while since I've called them. But there is a website.
The department.
Yeah, there is a website, the AIDS Clinical Trials Unit at Washington University, and you can contact and you can see all the studies that we're doing, not just the metabolic studies, and there are people that you can contact through the website that'll get you in contact with us if you're specifically interested in metabolic issues. But if you have other questions or other issues, it's a great resource.
Well, thank you very much for your time. I appreciate your deciding to speak for us in short notice, and good luck with their future research, and we're looking forward to more data. So,
No, thank you very much. It's my pleasure.